Hello and welcome to this special edition of The Chip. I'm Avis Favaro with a look behind the scenes of the Canadian Institute for Health Information as I talk to the outgoing CEO, David O'Toole. We'll learn about what he's seen data do to help the health of Canadians and what gaps there are in collecting that information. CIHI has been at work now for 3 decades, monitoring things like ER wait times, how long patients stand by for hip and knee replacements, and healthcare staffing levels, but there's much more data to be had. And it will be part of a revolution unfolding as Canadian provinces modernize their medical data systems to make patient records easier to see and to share, and to enact a pan-Canadian data charter to ensure the changes last for generations. So let's get to it. So I'd like to welcome you all to this special edition of The Chip. It's a podcast produced by the Canadian Institute for Health Information, also known as CIHI. And this show is being recorded live in Vancouver at the eHealth meeting discussing the future of digital health. It's May 27th, 2024, and I want to thank you all for joining us here. And this is the first show that we've ever done in front of a live audience. So thank you. And our guest is a very happy man who's been at the helm of CIHI for a while. We'll talk more about that. And this will be a very public exit interview as he prepares to hand over the reins in July. Please welcome David O'Toole. So you survived 10 years at CIHI.
Oh yeah, I wouldn't call it surviving so much as learning something every day and enjoying myself tremendously.
So number one, it's the longest position you said you've ever held with any one job.
Yeah.
So there must be...
Yeah.
So what is it that's kept you at the helm this long?
Oh, I think my background is in public service, and so I feel this is an extension of that work. And so it's the immediacy and the relevance of the things we were dealing with on a daily basis. There's a strong element of having to bring different constituencies and organizations together to try to coalesce around a common set of issues. And that was really challenging. But also, I think, more prosaically, it was helping an organization reach a certain level of maturity, like realize its potential to some degree from where it was when I joined and what I viewed that areas they needed to strengthen in order to really optimize the value of the investment that was being made in them every year with public money. CIHI's budget comes out of your tax dollars, and you should know what it does. It should be transparent to you. It should be available to you, and it should be making a difference.
So for people who don't know exactly what CIHI does, most Canadians don't know what CIHI does. Can you simply explain what it does and what it means to them, even though they don't see it at work?
Well, we're one of a very few organizations that are deemed to be prescribed entities. We have the legal authority to gather your personal health information without your consent and to hold it and to use it for improving healthcare delivery across the country. So we're largely, our most profound holdings are in acute care, but we have long-term care. We have 36 different data sets that were developed at different points in time to slightly different standards. So we have a governance issue ourselves to sort out, which we're doing now. But we hold a pretty profound amount of information about the state of healthcare in the country along different axes and with different domains. And we try to bring it together to give a coherent view of the performance of the different systems in relation to each other, with a view to them learning from each other in order to improve delivery overall. We spend $300 billion a year in this country on healthcare. We're one of the most expensive per capita investments in the OECD, and people should be able to make a reasonable assessment of whether they think they're getting value for money.
And have you seen examples where the data has made a difference, where you went, aha, this is why we need to collect this data, and this is how it can make things better for people?
Yes, I have. some of you may have heard this before, but early on in my experience at CIHI, we published a report on the use of antipsychotics in long-term care facilities for individuals, aged care, like senior citizens who had no indication of psychoses. And it was a clear indication that they were using, like an overstressed workforce challenge sector, capacity challenge, was using drugs to medicate their patients so that they do like chemical shackles to manage the population. And within about 6 to 8 months, that changed, because not only did politicians and senior officials become aware of it, the sector itself became aware of it and were kind of appalled. But also individuals were going to our website and taking a look at the indicators that we had put up there and going, I'm not putting my mom in there. So I think that was one of those rare instances where public consumption of the information we had, political awareness, and policy sensitivity also coalesced around that. And it really anchored in me early on the significance, importance, and relevance for public reporting and transparency on these issues a lot. And there's been other ones as well. I think we didn't do it, but the work done in BC on Indigenous racism in the healthcare system is pretty profound. Coming out of COVID, there was the clear differential and variable impacts on different, like the unequal impact, inequitable impact of COVID along racial lines, class lines, or economic means lines. Those are all things that allow people to understand and draw conclusions from literate use of the data.
So you brought up COVID, the pandemic. Did that highlight vulnerabilities in the system and black holes of data that you couldn't get or you couldn't get fast enough?
Well, the people in this room know this a lot better than I do because they lived through it. But I would say there has been a box full of reports written over the last 30 or 40 years about the inadequacies or the things that needed to be fixed in the healthcare system with respect to the gathering and use of data. And I think what COVID did was it's almost like that stuff was a little invisible, and COVID illuminated it from behind and made it glaringly obvious over the course of the pandemic. We needed answers to things like, where are the ICU, like where are the ventilators in the ICUs right across the country? We didn't have that. And so the information that was required to make day-to-day decisions to help save people's lives just simply wasn't available. And I think senior officials at all levels of government and across the organizations that we work with felt it very profoundly that this was a crippling inadequacy in the healthcare system. And hence, a lot of the progress that you've seen today, I think, is anchored in the reality of what happened during the COVID pandemic. We did fantastic things around vaccines and we coming out of it, but we also paid quite a price with respect to the penalties invoked on those people who were in aged care, because we were guessing at what to do with respect to protecting people's lives. So we locked them up. So
right. And how long did it take you to retool or add in the data that you actually really needed, that the health system needed?
It wasn't us. We were it was everybody in this room and people who were working in small and mid-sized institutions and hospitals who were gathering this information at the request of their provincial governments and regional health authorities, sometimes on a clipboard with a pencil.
Yeah.
Like some places have it automated and it was easy to get at the access. A lot of places across the country, that's exactly what was happening. Somebody got pulled off this job. They're in a workforce stressed environment, and they were given a clipboard saying, "Can you go do a survey of where the ventilators are right now?"
Are there still pockets of data that you can't get to give you the full picture, like family medicine? Oh yeah.
Who else would like to answer that question?
Clearly, there are spots that.
Well, primary care is there's progress to be made. The standards conversation will move the yardsticks. But primary care remains a big black hole, I would say. And the other part of it is, if we spend $300 billion a year in the country, $100 billion of that is not visible to us because it's paid for through the insurance companies. And we have to work with the insurance companies to get a more comprehensive picture. Like whether it's not-for-profits, whether it's Blue Cross or Green Shield or Manulife, like we have to work with them around standards and confidentiality and privacy so that we come to some sort of accommodation that allows the information that they're holding to have a better sense of how that money is being spent.
So I've heard the success. You've talked a little bit about the frustration, unless there are more frustrations that you want to share. I think there's more.
I don't want the, like,
things that you wanted to get done over your 10 years.
Like, no, I think I don't want, things I'd like to get done. There's a long list there, but I don't want sometimes we just sort of sit back and criticize or critique the healthcare systems because change takes place so slowly and over such extended periods of time because there's so many moving parts. We lose sight of the fact that there actually is progress being made.
One of the reasons that we're at this meeting is because it is about e-health and the goal of having a health system that's digital so that patients and healthcare providers anywhere in the country can share information when it's needed, and patients can see it too.
Yep.
And so your agency is part of this.
Yep.
It's part of your mandate to do this. Why is this meeting and the role of digital health so important in terms of priorities?
Some of the more mundane things that have been discussed over the last couple of days, like the mind-glazingly boring to most people, like data standards and interoperability, and the things that
I don't like that word.
You're not going to.
I don't like that word. Can anyone say it really easily? Interoperability. But you need a better word.
That's exactly the point that I was making earlier. Is that those sorts of issues that are so germane and foundational to actually wanting to make the progress that we aspire to are the things that didn't get paid attention to until the pandemic. And then during the pandemic, we were able to make the necessary link between the necessity of standards in order to do what you're aspiring to. You have to think and do at the same time and motivate or instigate activity along a number of different domains at once, not just one domain. It's like what I can imagine running a trace of horses would be like. If you've got 18 and you need to get them going in the same direction. Legislation, technology, standards established among public sector and private sector institutions. And I guess the other thing that I was thinking over the course of the last day, because the charter has been mentioned a couple of times, the charter of principles that came out of the recommendations on the expert advisory group on a health data strategy.
And what is that for people who don't know?
Well, first of all, I suggest you go back and take a look at the report of the expert advisory group. But there's the establishment of principles, and the reason that matters is because one of the contributors to disruption, or why we sort of take 2 steps forward and 1 step back, are because we get jammed in a political cycle where decisions made by one government are reversed or thwarted or changed by a subsequent government. And the significance of the charter is it's a principles-based framework for getting agreement in principle or consensus about what to work on, why it's a priority. And it's, in some ways, if we extended it into significant parts of the private sector and not-for-profit sector, we would start to contribute to the building of that consensus that would allow us to sustain a change in governments, because there would be unelected players in the sector and the stakeholders who've agreed to these things and agreed to work and collaborate together. And I think it's a really important aspect of the work that we're doing, that we have to figure out a way to motivate a collaboration that can extend over time and not just over 3 or 4 years.
So what is CIHI's role in trying to bring digital health across the country to people? You've got 800 plus scientists and data folks collecting it and analyzing it. How are you positioned to do this and move it forward?
I think we have to be willing to work collegially and collaboratively with just about everybody who's attending this conference to be transparent about what we're trying to achieve. I think we do have a role in establishing the data standards, as has been spoken to about 5 or 6 times today, and I don't want to belabor it, but I do think it's it's like establishing a common vocabulary for all the players in the system. That's, to me, what standards are. and syntax, lexicon, and vocabulary. We have a role in that with Infoway, with Health Canada, with all the provinces and territories. It's actually quite heartening, if you went to a number of the sessions today, the degree to which there's an intense investment of time and energy from all of those players on what amounts to the same agenda.
But other countries have done this, and they have nationwide digital health systems. Why is it taking Canada so long?
Everybody in the room is going to have their own answer to that question. But I think it's just it's a confluence of things.
What would you tell the average Canadian who has to wait, like the taxi driver that I was with, who had to get his prescription on a piece of paper and it was wrong, or you can't see your files?
Well, I think there's like 40 years of reports that can answer that question. They have laid them out going back to the Wilkes report before CIHI was created 35 years ago. But the good news is we've actually started to address them. So it's all of the things we've been alluding to here, Avis. It's chauvinism of provincial mandates, like the feeling that, like, I don't mean that in a disrespectful fashion because I used to work in the province of Ontario, but the desire for provinces to develop their own solutions to the same set of problems, the tension between the federal and provincial governments over funding and whether there should be terms and conditions attached to that, the nature of the professional relationships within the clinical community in healthcare as well, how clinicians get paid, the fact that for most of my life, people have equated access to healthcare with whether they can get to a hospital in 10 minutes or not. Like, so all of those things contribute to a very complex set of dynamics that don't make change easy or fast. And so I guess my answer would be we got the healthcare system Canadians want at this point. And if what they want is changing, or what they've been, no, let me put it better. We got the healthcare system of what Canadians are willing to accept. And if they aren't willing to accept it anymore, and we can help provide the evidence to help them inform their decisions, then that's a contribution we can make.
Okay, so what is your hope? You are now exiting July 2nd. Did you pick that day specifically? No. Canada Day, post-Canada Day? Yeah. What are you looking for? What would you like to see happen?
I would like to see, let's say, 4 or 5 years from now, CIHI looking quite different. I would like to see CIHI bringing in data that's near real time to like last week, but also having a really good understanding of who needs access to real-time data and who doesn't, and those constituencies that need more current data, getting it at the appropriate intervals. Like if you're a policymaker or a program designer, you don't need data from yesterday. If you're a clinician, you do. So getting the intervals right, getting the ingestion and access right, I think actually the roadmap that's in place now and the path forward is really good. I think I'd like to see progress towards those milestones. I'd like to see those indicators that are tough but doable, seeing measures of progress against them. And I'd like to see the charter adopted by a bunch of interested private and public sector organizations who would take it on as a kind of an agreement between themselves about what they're going to do, even if the government of the day doesn't pay any attention to it or reduces it as a priority. Because I do think that's a way of making considerable progress with the citizenry and with the major public and private players in the urban market.
Advice to your successor? What would it take for him to last 10 years?
I would say being impatient, respectfully impatient about the obstacles that you're going to confront. Actively cultivate relationships with partners that you want to sustain for a long time, not just transactional. None of this takes place quickly, and you can't do it without trust. So I would say get known, get trusted, and develop relationships with people that are going to sustain over 5 and 6 and 7, 10 years.
But just to end up, but it's always keeping the patient in mind and keeping the health providers in mind.
We should be contributing like, we're only relevant to the extent that we're relevant to patients. It's like, are we improving care, improving the quality of care, patient safety, patient access to their own information, and are we sensible to the average Canadian? Like, can they go into the CIHI website and understand very quickly what they need to know and why? And I think the patient experience and the relationship with the provider is the North Star for how we should be orienting models of care design, how we think about providing access to information.
All right. Well, listen, thank you very much, David, for your thoughts, your reflection, and thank you all for listening in. As David O'Toole heads off to new adventures, the new incoming CEO is Anderson Chuck. He's a health economist, most recently the chief economist at Alberta Health Services. He takes up the role in July. Meanwhile, want to learn more about the Canadian Institute for Health Information? Head to the website at CIHI.ca. That's CIHI.ca. And if you want to read more about the Pan-Canadian Health Data Charter that David O'Toole referenced, you'll find that at Canada.ca. Thank you for taking the time to listen. A note, there's a French CIHI podcast hosted by my colleague Aaliyah Niang. Please subscribe to The Chip wherever you get your podcasts. I'm Avis Favaro. Talk to you next time.